Thursdays at this time means we talk to Dr. B, Dr. Brent Wallis, People's Health, Chief Medical Officer of People's Health, as a matter of fact. Can physical activity help you live longer? Well, it is possible. Everybody can enjoy the health benefits of physical activity. Dr. Brent Wallis joins us now from People's Health to talk about the importance of staying active. Good morning, Doc. How are you?
I'm great, Tommy. How about you?
I am okay. I hope you had a good week. Did you?
Yeah, very good. Ready for the wet weekend.
I hear you. Tell me about physical activity. Can it really help you live longer?
Yeah, it definitely can. And the research shows that when people stay more active, they actually can increase their chances of living longer. And it's really because physical inactivity, which can lead to obesity, are really two of the biggest leading factors for some of the most prevalent diseases in the U.S., and that's stroke and heart disease. But they actually help. Physical activity actually really helps your overall health as well, and can help reduce your chances of developing conditions like diabetes that can lead to a lot of problems down the line. So really what you're trying to do with physical activity is more than just living longer. You're trying to live better.
I've noticed that after I work out, I feel a lot better, and I don't know what the reason for that is other than maybe I'm proud of myself or I feel as though I've accomplished something. What is the reason? Why do you feel better almost immediately?
Well, that actually means you did it right, which is a good thing. Physical activity does have a strong and immediate effect on your brain health. And you feel energized after a workout because your body releases something called endorphins. And the endorphins actually immediately make you feel better, but then have other benefits as the day goes on. So one thing that's really good to do is to exercise in the morning, and that'll kind of set your day. It can actually reduce your risk of depression and anxiety, and then even can help you get more restful sleep at night. And that restful sleep is really good for both your physical and your mental health.
Has there ever been any research conducted or proof that you should or should not exercise before you go to bed, that it'll keep you awake or make you tired, or is it just each individual is different?
Yeah, each individual is definitely different, but there has been some research that's shown that those endorphins can actually energize you. So some people, if they exercise later at night, can have a little bit of difficulty falling asleep. So that's why we usually recommended that you do it a little bit earlier in the evening or, like I said, even in the morning time.
Some people are, ironically, I work so early, but when it comes to exercising in the morning, I cannot do that. I will not do that, but I'll do it in the afternoon. How much activity is recommended, Dr. B? Because you're not training for the Super Bowl, right, or the Olympics. That's not the goal.
No, not at all. I mean, you can be moderate about it, and it does vary based on your age. So, you see kids running around, they actually have a lot more energy than adults, and so they typically need more activity to stay healthy. But for most adults, actually getting about 150 minutes a week of moderate intensity activity is plenty, and you usually break that up, 5 days a week. You can do 30 minutes a day. And that activity can be something as simple as walking, biking, swimming, which really is great during the summertime. So you really choose those activities based on what you enjoy and what your ability and your fitness level is. For about 2 of those days during the week, you want to also do a little bit of weight training to strengthen your muscles. And so what I usually recommend, it's hard to go out and buy a weight set, and you don't need to do that. You can actually use things around the house, cans of soup, a half gallon of milk, a half gallon milk carton filled with water is about 4 pounds, and that's plenty of weight to lift with your arms to kind of improve your muscle strength as well.
And one thing I've noticed, it seems like when you're younger, you always want to get stronger, right, and all of that stuff, and faster, and this and that and the other thing. But as you age, you can't train as hard, and it's not as. I guess you need to change your goals, is the way I'm trying to put it, Doctor. You keep in mind you don't have to always add more weight, more time, more this, more that, do you?
Yeah, you have to know your limits, and actually, if you're trying to bulk up, which is what younger people are doing most often, that's where you would escalate the weight. But actually, for maintaining your health and your physical activity, you really don't need to do that. It's really just having that activity level and making sure that you're keeping your muscles strong and toned that really provides the benefit.
We're going to pick it up here when we come back. We'll talk about focusing on physical activity and strengthening. I remember a long time ago they had a commercial, Doc. I don't know if you remember, but Arnold Palmer, the late Arnold Palmer, was out there jogging on a golf course, and he said it was just making sure that everything was still working. And I guess that's what it's about when you exercise. Dr. Brent Wallis, our guest. If you have any questions, you can text them to 504-260-1870, our mortgage financial line, and I'll pass them along as we talk about senior health. It is 8:21. It's time for traffic on WWL. 25, Dr. B is our guest, Dr. Brent Wallis here on WWL. He's the Chief Medical Officer of People's Health. I'm Tommy Tucker, and we talk about senior health on Thursday morning at this time with People's Health to help you if you're a senior, or maybe if you're a grown child of a senior, a son or daughter, and you want to keep your parents healthy. So why, Doc, as we talk about exercise, why the need to focus on physical activity and strengthening?
So for our senior population, one of the biggest risks that we have is loss in bone density. And when you lose bone density, you're more likely to have a fracture, so a break in a bone. And so by doing regular and routine strength training and exercising, you can slow progression of that bone loss that is a natural part of aging. And, in addition to that, physical activity and that strength training can really help to improve your coordination. When you improve your coordination, you're less likely to fall down, and those falls are what can lead to those breaks. It also can really be helpful for arthritis. Arthritis is a condition of pain in the joints, and the activity that you do can decrease that swelling and inflammation that occurs in the joints and make you feel better. And it really just helps you do more of your daily activities without having pain and problems with that.
And in these days and times of social distancing, you don't really have to go to a health club. You can't, or buy some kind of necessary, some kind of jogging equipment or outfits or anything like that. You can if you want. And I guess what I'm trying to say, Doc, is you just got to, it's a matter of doing it, not necessarily what you're wearing or what you have, right?
Yeah, definitely. Certainly we know gyms are all following social distancing rules, but if you don't feel comfortable with that, you don't really need to do it. There's plenty of stuff that you can do around the house that keeps you maintaining that social distance. Household chores can be very vigorous and very beneficial to you. Mopping and vacuuming, cleaning around the house. You can simply get outside of your house as well and walk around the block. Vigorous walking can be very beneficial for the heart and can help strengthen your muscles as well. And then, the thing you have to really watch, we're sitting at home watching a lot of television during this time, and you can even stay active while watching TV. You can stand in front of the TV, you can do sit-ups, you can walk in place. It really doing that physical activity is so important. It helps you get the restful sleep that you need at night. And what's kind of an added bonus to it is physical activity and getting a good night's sleep actually improves the health of your immune system as well. So during this time where we're real concerned about infection, this can be a great way to try to prevent any problems down the road.
Yeah, I think if you look around your house, it's amazing the things you'll find. I have a kind of long foyer that runs from the front of the house to the back of the house, and I do like shuttle runs back and forth. It seems silly, but you'd be surprised the exercise that you can get doing that. And I guess, Doc, I was given a car away at a casino a long time ago, and a gentleman was there on one of these little rascal things, and he just looked at me and he said, "Man, don't ever lose your legs." And that's very important. But, it's kind of... That's almost one of the more important things we can pass along, is it not?
Yeah, we say a lot, use it or lose it, and it is very true. It's important while you're, when you're a senior but you're in good condition and you're healthy, you want to maintain that health. And as you start to lose it, it can be a little bit difficult to gain it back. So really establishing a routine where you're staying active, you're not extremely sedentary and never leaving the house can really benefit you as you get into your later years.
Thank you, Doc. A pleasure as always. We'll talk to you next week. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. You can find out more at peopleshealth.com/radio. You can call 1-855-821-2666. And you can follow People's Health on Facebook, Twitter, or Instagram.